Okay, this is your lecture over chapter 13, which is social workers in mental health. Mental health is one of the things that has really seen an increase in awareness in the last 20 years in our country, which is a very positive thing. Um, this is very positive because this is a very prevalent problem. Okay, more than 25% of all people in the United States will develop some type of mental illness during their lifetime. So 1 in 4, a quarter of all people, will develop a mental illness. What's even more troubling than 1 in 4 developing a mental illness is that almost half of all people who receive a mental illness, who have a mental illness, will not receive any type of treatment. And whenever I say any type of treatment, I mean no counseling, no any type of therapy, no pharmaceutical therapy, nothing. A lot of this is due to stigma or because of lack of access to mental health care. Mental health is just the psychological and emotional well-being of an individual to where they can make rational decisions and they can cope with stressors in society and they can adapt to changes in society and they can maintain their self and their mental health. Okay? Now everybody is going to experience some type of problem with this. We all have stressful days. Mental health or mental illness rather is going to be whenever you don't have the ability to cope with those new stressors. Okay? Mental illness is a wide range of psychological, emotional, or cognitive abilities to where you cannot function. Once again, everybody's going to have hard days where functioning is harder, or you don't want to do it. You may even have a day where you take the day off and you don't do whatever it is that you're responsible for doing. Mental illness is whenever you can't really control that. Okay? Now, when we see social workers working in mental health, a lot of them will work in either inpatient psych hospitals, where it's basically a psychiatric hospital where the patient lives there for a short period of time or maybe an extended period of time. Psychiatric units in hospitals, almost all hospitals have some unit that is devoted to psychiatric treatment. Residential treatment centers, once again, this is sort of a long-term place where people can live and get the help that they need. Outpatient treatment, this is a treatment center, but the people don't live there. They come there for treatment and then they leave the same day. Community mental health centers, this is a group home of some sort, or employee assistance programs. Employee assistance programs, many places where you work, they have employee assistance programs that help with a variety of different things, such as financial planning, but also mental health treatment is going to be many times a part of that because in the last 30 years in the United States, employers have started to notice that if they can take care of their employees' mental health, then productivity increases, absences decrease, and many other positive things for their own business that they can achieve just by helping their own employees deal with their mental health. So, if you're working in one of these places, how do you classify mental illnesses? Typically, the first place we start is with the Diagnostic and Statistical Manual of Mental Disorders. This is often referred to as the DSM. The current edition is the 5th edition, but it is a text revision version of this. And this basically describes each diagnosis in detail, along with giving diagnostic criteria. And typically in the DSM, it'll list all of the criteria that you must have in order to meet a mental illness, a specific mental illness, like a generalized anxiety disorder. And there may be 11 different criteria, and it'll tell you that if a client meets 7 of these 11 and this has persisted for more than 90 days, then it would meet the criteria for generalized anxiety disorder and things like this. These are interesting books to look through. I will tell you, do not use these on your friends and family. It's very tempting to do this and say, oh, well, mom's got all of these criteria, or I myself has these. If you remember the family, you are not qualified to do this. It is an ethical violation, and you're not approaching things objectively, especially if you're using it on yourself. Okay? It is just something to keep in mind. Now, as a tool, this is a very good tool, but its strength is its same weakness as it reacts to society. To whatever society tells it to do, the profession typically follows. You think about prior to the 1970s, homosexuality was listed in the DSM as a mental illness. while it wasn't called a DSM at that time, there were mental health professionals in the mid 1800s in the United States that wrote about the disorder of slaves running away from their masters and how that showed mental illness. And you think about in modern times, we look at that and say, that's just irrational. Why wouldn't a slave run away from his slave owner and try to get to a better life? So the fact that they react to society can be a strength, but it can also be a weakness of this particular method of diagnosing mental illness. There are some common disorders, certainly. Dementia is one I want to talk about. People with numerous cognitive problems, such as Alzheimer's disease and things like that. I want us to remember that dementia is not a normal part of aging. Less than half of the people, as we age all the way up until death, more than half of the people have never experienced any symptoms of dementia. But oftentimes, whenever older people forget something, people say it's dementia. But all of us forget things. We need to be very careful of self-fulfilling prophecies, especially in mental health, where we say, oh, well, this person is meeting this criteria. We need to look at that very objectively and make sure that they're not meeting it, and make sure that they are meeting it, and that we're not just seeing what we want to see from time to time. Psychotic disorders. Schizophrenia is one of the most common that we will see for our large-scale psychotic disorders. Common symptomology of that would include delusions or hallucinations, confused speech, or along with the flat affect, which appears to be emotionless but is actually just kind of below the surface, where it's hard to tell what emotions are going on, along with psychosis, which is a loss of contact with reality. This is very common, and it often manifests itself with people that are in the college student typical age range of 16 to 25. The reason I picked this particular psychotic disorder to talk about is because it's one that is should be easy for us to build empathy towards. You think about that, the loss of contact with reality. If someone who's dealing with schizophrenia tells you that, the devil is talking to them or something like that, if you don't have schizophrenia, that may seem like such a way outlandish thing that you're like, of course that's not real. Why would you even consider that it is? But in their mental state, if that is real, I want you to think about how frightening that could be. Okay, if you cannot tell illusion from reality or delusion from reality, that is a very, very scary place to be. And these people need a lot of compassion whenever we are dealing with them. Mood disorders is another type of disorder. It involves disturbance in mood, attitude, or emotional state. Typically, depression is the most common type of mood disorder that we see in the United States, along with anxiety. All people have anxiety, but whenever anxiety reaches the point to where you can no longer live with it or function properly, that's whenever it goes from just regular folks having anxiety to being a real mental illness, okay? And that's the way it is with almost all mental illnesses. Once they get to a point where you can no longer function in society, then it is a problem, okay? There are other disorders, dissociative disorders, sexual disorders, sometimes referred to as paraphilias. Sexual disorders are not a problem until they start causing problems in that person's life or they are harming other people, okay? And when they become coercive and are harming other people, then they are obviously a problem. Eating disorders, because of the health implications to the person themselves, these are considered mental illnesses such as bulimia or anorexia. Impulse control disorders, when people are not able to control some activity that may cause them harm. Kleptomania, when people just compulsively will steal. Or trichotillomania, whenever people will pull out their own hair from their scalp or their eyelashes or their eyebrows, and then many times they're not aware of it or that they cannot control it, and it actually does cause them harms. There's also personality disorders where patterns of behavior, emotions are uncontrollable, and it can cause more social problems for the person that is experiencing that disorder. Now, in our society, we have developed a lot of medications that can really help people deal with these particular illnesses in their own lives. These typically fall under a few different categories, such as antipsychotic or antidepressants. Antipsychotic typically we use to treat schizophrenia. The sort of granddaddy of all of those would be Thorazine. Antidepressants would be Prozac and Elavil. Mood stabilizers, or like lithium, would treat bipolar disorders or anti-anxiety, such as Xanax or Valium. The most common psychostimulant is Ritalin, which we use to treat ADHD. Psychotropic drugs have been, by and large, successful in helping people deal with some of the more debilitating symptoms of their mental illness. Now, do they really treat it and make it totally go away so you get it to stop taking the medication? That's very individualized. But because the medications are costly and there may be some stigma attached to them and you have to get them from a medical professional, a lot of people may not take their medication as prescribed, or they may not ever seek it out, and they may try to self-medicate. This is dangerous because they may not have access to the real medication, or they may use alcohol or other street drugs in order to try to alleviate the symptoms of their mental illness. It's dangerous, and in many cases it's illogical that they try to do that, and potentially illegal if they're using illegal drugs to do this. There's getting more research done about some street drugs, and there may be legitimate medical uses for them. However, right now, if people are trying them, it's a little bit illogical because you don't have the medical research to back up this. Just because some person tried marijuana and it helped with their anxiety does not mean that it would help another person deal with their anxiety, which might come from a totally different place or have a total different cause for the problem to start with. Now, this is really, once again, really brief. I tried to hit the very high points of this particular lecture. A lot of students are really interested in this, so if you have more interest in that, I would encourage you to bring that up in class. And if you have questions about what I said in here, please don't hesitate to contact me.